We have Daniel Beck, who is the Communications Director for gottransition, a program of the National Alliance to Advance Adolescent Health, where he is responsible for all outreach and communications of the federally funded National Resource Center on Healthcare Transition. Dan is also responsible for tracking and program monitoring program efforts with state Title V agencies, website maintenance, and assisting the policy research. He assists in quality improvement efforts, technical assistance oversight, and advisory team engagement. He's also a freelance writer and historian. Mr. Beck received his master's degree in American Studies from the George Washington University. That's very interesting, Dan. That's neat that you're a historian. Thank you for being... Yeah, exactly. That's really interesting. All right, I will let you go ahead and share your presentation. Thanks for being here today.
Of course. So, how's that look?
Looks good.
Okay.
Thank you.
Of course. So, I just wanted to thank everyone for having me. Feel free to jot anything down in the chat box during this. Again, my name is Dan Beck. I work for gottransition. So, let me see. Did that go to the next slide?
Yes, you did. It looks good.
Okay. So as mentioned, we're a program of the National Alliance to Advance Adolescent Health, a small nonprofit here in DC. We're supported by the federal government. So just so put this up front, that these don't necessarily represent the official views of HRSA, HHS, or MCHB, but we do have a grant. We're fully funded by a grant with them. I just wanted to quickly say what I'll be talking about in this presentation. Quick background on gottransition, since you've heard, if you've been on since 11, you've heard us referenced a few times. I know that Dr. Jan and some others have mentioned our material, and so we're really just going to be going over a brief overview. A lot of this is going to be repetitive from this morning, but what the goals of healthcare transition are, a quick discussion on where the underpinning, the background, the foundation of healthcare transition and the recommendations come from, which we've turned into the 6 core elements of healthcare transition. You might be familiar with those. And then just a review of some resources that we have. So this has been kind of mentioned before. When people think of transitioning to adulthood, oftentimes people think of post-secondary education, going to college, community college, associate's degrees. People think about getting jobs. People think about living on their own, being independent, but oftentimes people don't think of health. Gottransition focus is solely on this often overlooked health side of transitioning to adulthood. We always tell our young people, we work with a lot of young people and they all want to get jobs, they all want to live alone. It is one of the least exciting things about getting old is taking care of your health care. But we always say, in order to be able to do those things, to get a job, to keep a job, to be able to go to your job, you have to stay healthy and you have to take care of your health and your health care, going to the services. Oftentimes we think of this transition to and the transfer that we've heard about today as kind of getting in, getting into a cannon and being shot off towards internal medicine. You can replace internal medicine with adulthood. People just say that this is, you're off, you're on your own. But as Anna and Michelle said, this is really a process. It's not an event. It's something that should start very early. Just so a background on gottransition. So we are the National Resource Center. So we often kind of are elevated to a higher level of, legitimacy because we do have funding from the government to say that this is an important thing. It's really important that the HHS, HRSA, Maternal and Child Health Bureau have said that transition is a really important part of all young people's lives, those with and without special healthcare needs. So we have a few goals at gottransition. We work with the AAP's Medical Home Center and the Financing Center at Catalyst Center, which is up in Boston University, to work as a national network for advancing services for children and youth with special healthcare needs. This is an important network that we have, and we do a lot of really great work with them to say how transition should be a part of every young person's medical home, especially those with special healthcare needs. As with this event today, we do a lot of youth, young adult, and family engagement, talking to young people and their families that this is an important part of their life. Looking at our policy and evidence to see why transition works and why it's important. So we do a lot of research. And then a lot of our work obviously is with our health systems and practices. So ideally, this is something that you all as young people and families will hear about and understand is important, and go to your doctors and say, hey, how would you help me with my transition to adulthood? And they ideally would have some systems in place in their practice to help you do it. We obviously have a lot of partnerships around the country with different groups, and then we operate gottransition.org. So I just want to say up front, everything I talk about today, any resource or information can be found on gottransition.org. It's a really important site for you all who are interested in this to go to. So as we've mentioned before, what are the goals of healthcare transition? I mean, the main goal is to improve a young adult's ability to manage their own health, to get to health services, and to be as healthy and happy as possible as they transition into adulthood. And the other, on the clinical side, is to ensure a planned process for the transition preparation and then the eventual transfer into adult care. It's important, a lot of people always say, well, I'm in a family medicine practice, so I don't need to do this. You know, I'm just going to see the same provider from birth to death, and there are family medicine providers out there who will see people throughout their throughout the lifespan, but it's really important that this is an approach to healthcare. So the things we talked about and that we've heard about before, speaking up in your practice, you know, knowing your own condition, your own medications, all those things are things that whether or not you actually transfer to a new provider, you should be transitioning into an approach of adult care where a young person who is able to can do those things on their own. And we've seen that having this structured process improves health, the experience of care, utilization of care among young adults with and without special needs. So I just want to quickly go through where this all comes from. Transition is something that a lot of people say, well, where did this all come from? Why do we have age 12 as something that we need to look at? So there was a clinical report written. It first came out in 2011. It's been updated and reaffirmed year after year from the American Academy of Pediatrics, the American Academy of Family Physicians, and the American College of Physicians. So pediatric providers, family medicine, and internal medicine providers all got together and said, this is important, and let's think of what should be happening at different ages. So it can't get any more it can't get any more to the higher level of recommendation of this is something that we know is important. It targets all youth beginning at age 12. So you might have heard that age 12, this is just a recommendation from all those organizations out there. It's an algorithm structure. So basically, if you're a youth with special healthcare needs, there's different ideas and topics that you would that providers would need to look at for a young person with complex medical conditions. And it does apply to primary and specialty care practices. A lot of people say, oh, this just sounds like something my primary care provider should deal with the transfer and the transition. But we know that this is something that's important for your specialty practices as well. And so this goes from that 12, 13-year-olds all the way through into adult medical home specialists. Like I said, it's been reaffirmed and updated just recently 3 years ago. You'll see on the side, these are some similar dates. Youth and families should become aware of a transition policy around age 12, around age 14, that's when the planning starts. 16 is when the preparation for an adult approach to care begins. When that timing is going to happen, that discussion happens. Age 18 is when the transition typically would happen, and then age 18 to 22 is when the transfer of care actually occurs. So these, again, are the recommendations from those professional organizations from years ago. So what we did at GotTransition is we took those 6 core elements, or we took those elements of the recommendations and turned them into the 6 core elements approach. So it's based on, this has gone through tons of quality improvement collaboratives in numerous states. A lot of the materials that you've heard about before and that you'll see today during my talk all are related to these 6 core elements, but they're really primary and specialty care based tools that can help smooth this transition. So this can also be in school-based health centers, behavioral health, reproductive health. They've been customized. They've been, like you saw before, Dr. Jan had entire tools specific for conditions. You know, we go to organizations all over the country and we customize them for specific conditions and help them do that. So these are the tools. They look similar, obviously, with the ages. Having a policy at the practice is important, and we're going to talk about what your role in that policy is. Practices should be tracking, you know, what young adults they have in their practice, and then they should be helping young people and their parents figure out how ready they are to make this transition to adulthood. Transition planning obviously is important. We all have plans. You don't just go to college, you know, you have to fill out your applications, you have to meet with guidance counselors. So it's the same for health. You need to develop your transition plan, including a medical summary, as Dr. Jan talked about this morning. And then in the 18 to 26 is when this transfer ideally is going to be happening. And again, as Dr. Jan mentioned, practices and providers systems have different ages cutoffs that you need to be aware of, and we'll talk about kind of your role in that. So major resource alert. I know that this was referenced before and linked, and I'll link it at the end of my presentation, but the Family Toolkit really is a great place for you all to go. It's a small little PDF of a dozen or so pages that you can look through, where all of the information I'll be going over today is referenced. So I really highly recommend you either now or later. Nicole will be including it in the follow-up survey and everything, but I really encourage you to go to this toolkit, because all the stuff I'll be talking about now is located in this Family Toolkit. So one of the questions that we always get is, well, what's the actual difference between pediatric and adult care? There's a whole page in the toolkit about this. I just threw some of the bullet points up here, and reading through them, you'll start to clearly see a similarity between the left side and the right side. As with a lot of things in life, the pediatric care, a lot of things in terms of our childhood, parents and caregivers are helping do or completely do all these things. So that's answering questions, making choices, making the appointments, filling out medications, picking up prescriptions, knowing all the test results, health insurance, all these types of things. In adult care, whether it's adult approach to care or where you're actually seeing your own adult provider, we encourage young people, as best as they are able to start to do some of these things on their own. It's important to see the doctor alone, to answer questions and to ask questions to your doctor about your condition, making your own choices. We'll talk about 18, and I know we've mentioned that before today. Making your own appointments, having your doctor's phone number in your phone, all these things are really important aspects of a young person's health. And these are just a clear way that the pediatric and adult care differ. Again, Dr. Jan mentioned this before with her timeline. We have the timeline included in our toolkit. A lot of people are kind of nervous of what should I be doing and when. And so I've got transition timeline. A lot of this looks similar to this morning's talk, but this really should start and can start around 12 to 13. Learning about health conditions, medications, asking your doctor yourself some questions. Parents maybe saying, hey, why don't I step out? Or the young person on the call here, asking your parents to step out and talk to your doctor alone. As I mentioned before, most practices and providers will have a policy about when you need to transfer out of a pediatrician's office. And so this is a good time to ask, when is this going to happen? Is it 18? Is it 22? With ACA and insurance coverage up to 26. 26 has been a common age recently. Finding out what you know about your health and healthcare is an important aspect about in your mid-teens. That's when you start to learn about your family medical history and filling out a readiness assessment about how ready you are to transition to adult care. We'll talk about the readiness assessments later. Some of the language will sound similar to some of our conversations this morning. Insurance is really confusing for a lot of young people. I didn't understand it, and I still often don't understand it, but it's an important thing to start to think about and to talk to your young people about, that insurance is really key. Carrying their health insurance card in their wallet. Everyone's got a wallet or a pocketbook by their mid-teens, so making sure that they have that on them at all times, really important. Again, what to do in a case of emergency. This is a real tough thing for young people to think about. Dr. Jan started off this morning's meeting with that hypothetical situation, and so we have some tools which would help that I'll discuss later. Prescriptions, medications are a real big part of healthcare, and we encourage young people in their mid-teens to start to fill their own prescriptions, go get their own prescriptions. I know that for me, driving to drug fair to pick up my prescriptions was always a welcomed time to use my license and get out of the house at 16 or so. So that's always something that we encourage young people, if they're able to do that as well. And then as you start to get towards 18, a lot of this is happening. A lot of these things are what you should be doing on your own, making the doctor's appointments, filling those prescriptions, starting to talk to your doctor about privacy rights when you turn 18, and then obviously making a working medical summary, which was discussed in a little bit more detail this morning. We'll talk about 18 because we have a whole page dedicated to it that we encourage our young people who are getting to that age or who are at that age to look at. But 18 to 21 obviously is an important time to start to make that transition if you are going to be transferring to an adult provider. So calling the new doctor, making sure that all of your medical information from childhood, from the pediatrician, is transitioned over as well, and then starting to make that new adult practice meeting, and then staying insured, staying covered. Preventive care is so important for this age. I mean, there's a whole site dedicated to that we work with called Young Invincibles. Young people think that they don't need to go to care, but making sure that they still go to care when they need to is so key. So this was referenced this morning, and I'll include this link in the chat as well. But adding your health information to your smartphone, such a great way in terms of an emergency. I have it on my phone. If you go on your lock screen, you can see in the emergency in the bottom corner, it'll bring up your medical ID. So we encourage all people, not just young people, but all people to fill this out. You can see here, right in the bottom corner is your medical ID. If you click on it, I've got all my information there. My vertigo and my hypertension are there. So if I ever was dizzy or passed out on the street, someone would note that I'm not having some kind of epileptic shock, that my blood pressure might be high. And so it's a real great way to put all of your information on your phone. And in case, God forbid, you're ever found on the street, an EMT could check it, find out who you are, what your condition is, and who they could call to help. This again was referenced a lot this morning. I just wanted to take a second to show, our tool. It's pretty concise, and we encourage parents and young people who are of this age to check it out. But we have a whole document, turning 18, what it means for your health. So, as it's been mentioned, there's a lot of things to know at 18. It's you, not your parents, who are making decisions. We encourage everyone, if they do want extra support or have questions about getting extra support, to go to the National Resource Center for Supported Decision-Making. But this is a great tool for you to encourage your young people to look at around 17 or at 18, to just say, hey, do you know that this is a big thing for your health care? Another tool that's included in the toolkit, a lot of people are always kind of nervous about talking to a doctor. I know I used to hate talking to the doctor, and just like with anything else in life, it takes practice, but it also takes some preparation. So people will say, well, what are some questions I should ask? We have a whole document here. This is for youth and young adults. There's another one for parents and caregivers, which is just different wording. You know, when does my child need to start to meet with you on their own? But it's a really helpful tool here for you to go in with a plan to talk to your doctor. You can jot these down on a little notepad. I have a little notepad that I bring with me when I go to the doctor. And so some of these are good questions to ask. Working with them to create a medical summary is something that everyone should do, and that we encourage you to do at this time. So here's just a script. When do I need to start to learn to get ready for adult health care? At what age do I need to change to a new doctor? Asking about their policies. So we want to make it pretty clear that you have a role in this, and it's really important to chime in when you think it's necessary that your young person's not getting the care that they should get, that they deserve. Here are some questions important to ask before making the first appointment to a new adult doctor, and then before the first actual visit. So asking that new doctor, you know, do you take insurance? Any payments? What are the office hours? Things like this. Questions that you might know to ask, but in the moment, it's best to just have a little script there. Bring it in with you and just ask the questions that you've already prepared. A lot of people wonder, you know, are you ready? Are we ready to do this? Like, how do I know when I can do this? So at gottransition, and this was referenced before, but we created these little quizzes. If you want now or later, they're also linked in the family toolkit, but we have one quiz for youth and young adults and another one for parents, caregivers. Similar language, just different wording for each, but it's a little 6-question BuzzFeed type quiz to find out whether you are ready to do this or whether you might need a little extra time. So we encourage you can use your phone right now to take a picture, and the QR code should bring up the pages. Or again, as I mentioned, if you want to do this later, this is referenced in our toolkit. The other tool, and I know Dr. Jan mentioned this and others, the Readiness Assessment is one of the most important parts for young people and their parents within the family toolkit. Now, I know, you know, the transition readiness is kind of a nebulous thing. How do I know that I'm actually ready to do something? So we created this readiness assessment. There are dozens of readiness assessments out there for different conditions. We've created them for a number of conditions, a number of populations, but this is a really good tool for youth and young adults, as well as parents and caregivers to fill out. So in that family toolkit, again, it's really helpful to go check that out. Everything I'm mentioning is right in there, but we have a copy of this one on the screen for youth, and we have another one that's for parents and caregivers. And what we found is that oftentimes young people will fill this out, and we have our parents and caregivers fill out theirs, and then they'll compare their answers to the specific questions under each subsection. So for instance, the top two obviously are a little bit more subjective. You know, how important is it for you to transition, and how confident do you feel about your ability to do this? But in the heart of the page here is the My Health and Healthcare, and then the My Medicines. So for instance, we've done this in workshops with young people and their parents, where the young person will say that, yes, I can explain my healthcare needs to others, whereas mom or dad or, you know, their caregiver will say, no, I don't think they do, because the question for them is, can my child explain their healthcare needs to others? And it'll be funny to see these instances where mom or dad will say, well, I don't think they've been paying attention. You know, they never seem like they do. And the other person will say, yeah, I know what it is. And then they'll just rattle off their condition and when they had their surgeries and what they need to do with PT and whatever it is. And it'll be a funny instance where the parents didn't realize how ready this young person was to do a lot of this on their own. Conversely, we've seen where young people will say, no, I don't know my medications. And a parent or caregiver will say, well, yeah, they know. I mean, we fill it out all the time and they take it every day. Of course they know what their medications are. And so the young person will say, I could not tell you the name. I couldn't tell you how much it is. All I know is I have to do it every day at 10 a.m. by mouth with water. That's all I know. And so it offers a good opportunity for young people and their parents to actually sit down and say, what do I know, or what does my young person know, and what can we work on? I mean, that's the most important thing about this. As Anna and Michelle mentioned before, this is not an event. Transition is just like anything else in life. It takes incremental change. It takes you to get comfortable with those changes, and then it takes making a little bit more of a change. So we have this section down at the bottom. Which of the skills listed above do you most want to work out or to work on? So we encourage young people, take this at 14. Have mom and dad take this when you're 14. Compare and see, maybe there's one thing that you guys want to work on this upcoming year. Maybe it's learning, maybe it's putting your doctor's phone number in your phone. I mean, a lot of people have smartphones nowadays. You just throw your doctor's name and number in there, and in the notes section of that contact, you can put when their contact hours are. So working on something each year, and then we encourage our young people and the parents, take this every year. Make it an event where when you go for your yearly checkup, also take a readiness assessment. And it'll offer you a good opportunity to see how many of these check marks go from the left or the center off over to the right. And that's really all we want, is just to see small incremental changes that over time can show that you're really ready to make these major changes. So I know I went through things kind of quickly. If you've been on since this morning, you've heard a lot of this information, but we do encourage you to go to gottransition.org. We have a whole page dedicated to youth and young adults. We also have a whole page dedicated to parents and caregivers. We have tons of top resources on those pages that are specific for parents and caregivers or for young adults. So this is the young adult section. You can see here, all these are easily downloadable PDFs. A lot of the information is really important, but it's also sometimes easy to ignore. Yeah, I can do that, or I can try this at another time. But we encourage you, really, really sit with your young adults and say, what of this do you want to take on yourself? Because it'll really benefit everyone in the long run. Transition's a really big topic that encompasses not just health, as I mentioned. And so we have a whole frequently asked questions section on our site, both for young people and for parents and caregivers, with some parent and caregiver specific questions. But this is a good section of our site where you can just scroll through. There's some questions that you might ask or might have thought of asking, maybe not have even thought of asking. A lot of this is, you don't know what you don't know. So we encourage you all and your young people to go check out this part of our site to really see what else out there. Under each of these questions, there's a little short answer and then some helpful tools and resources for you. Some of them are not just Transition resources. We send you to other sites that we think explain this or do this just as well as we do. So if you can't find what you're looking for, or you have a specific question, please, please, please email me. It's dbeck@thenationalalliance.org. The one thing that I will say is that we don't provide any direct services, right? So we're a national resource. We do work all over the country, all over the world. People are downloading our materials. I just had one yesterday from Italy, someone else downloading it from Germany, from China, from Chile. So we don't provide direct services. So if you email and say, we're trying to find an adult doctor in this area who accepts this insurance, we encourage you, as all of the previous speakers have mentioned, to talk to your current provider about any doctors they may accept, talk to other friends and parents who may have already made this transition in your area. But that's not really what we do, is finding you, an adult provider to transition to. So unfortunately, we don't do that direct service type work, but we're happy to encourage you and push you forward with, our materials and information. And obviously, don't forget to follow us on Twitter and like us on Facebook. We're constantly putting up new tools and tips and kits for everybody. So I really appreciate everything. I wanted to end a little early just so I could open it up for questions, and thank you so much.
Thanks, Dan. Thank you. You know, to your point, you said you're not a direct resource. GotTransition isn't. However, I know, for example, our MDA Resource Center has you guys as a resource, and that's something that we can do for our families and for anyone listening, is help them find, you know, an MDA care center with transition care, or at least transfer from a pediatric facility to an adult care facility that would be in your state, if not necessarily in your town. I know a lot of our people online, you know, don't necessarily live in a city. Some of them do live kind of out in the country. So that finding a place to go to get your care can be a little bit more difficult. But you did mention that you're nationwide. How do people find out the information for their state? Was there an email or a 1-800 number?
Yeah, so in terms of state-specific information, you know, we always encourage you to look to your family to family or your family voices.
Okay.
They are really good opportunities. And we work a lot with our, you know, the family voices from each state and the National Family Voices group. So if you just look for family to family or F2F,
Okay.
There's centers and organizations that would help you help families all over the country. I think every state has one. Sometimes it's based in a university setting. Sometimes it's a health system that has, you know, a portion, or sometimes it's just its own standalone group. But yeah, if you're looking for kind of more state specific, I would encourage you to just reach out, just type in family voices and your state. There should be some good resources there for family information.
Okay.
The one other thing I wanted to mention too, I know that, you know, we're in a weird world where, you know, sometimes we can't see providers in person. Telehealth has become a really important aspect of care. And so Family Voices, the National Family Voices, has been doing a lot of work on helping families and young people navigate what telehealth looks like. And we are currently putting out a tip sheet on what transition in a telehealth meeting would look like. So,
that's very interesting.
You know, it's unfortunately something that currently a lot of insurance doesn't pay for, that type of joint meeting, a joint telehealth between a pediatrician and adult provider. But it's something that we're really pushing for, because we know the power of having an adult provider with the pediatrician and, you know, the young adults and whoever is on their care team, all on a Zoom or Microsoft or whatever telehealth, you know, platform they're using, to say, hey, they're 22, they want to transition to adult care, let's make this happen. So that's a exciting opportunity that we're hoping is a pretty more widespread thing in the future, and we're going to be putting that tip sheet out in the next, I think, Monday or Tuesday. So keep an eye out for that.
Okay, that's interesting. You kind of forget about the telehealth, or that could be part of your transition. So I just wanted to say thank you very much, and I wanted to let everybody know that I am going to put that link into the post-event email that I send everybody with the survey. So feel free to download that. And I have to say, I did do the QR code for the parent or caregiver, and I'm not quite there yet for transitions for my child. So I'm almost there, but that's a really easy quiz to take. So thank you for putting that up.
Of course, and let me just, and if anyone wants to check in the chat, I'll throw up the links right now.
Okay, perfect.
You're more than welcome to look at them now, later in the day, but we really, I cannot stress enough that this is a process. It's not an event. If you feel overwhelmed, like you think you haven't done enough, or you should be doing more, step back, breathe. I'm sure you and your family are doing the best you can, but just making those tiny little changes to get it to the next step, so everyone is, you know, as independent and healthy and happy as possible. So
Sounds good. Thanks, Dan, for being here, and thanks for all your information. It was great and resources. So thank you.
Of course, thank you.